Hello everyone, my name is Kimberly Orbons and I'm the head naturopath for the Lucy Rose Clinic. I've managed the Adelaide Clinic for 3 years now and am lucky enough to work with a lot of our other naturopaths for the past 2 years. There are so many contributing factors to poor thyroid function and hormone imbalances, so today I'm going to talk briefly about a particular source of thyroid blockers. These are called halides. So in particular we have your bromide, fluoride and chloride, which are the main competitors with a very metabolically essential halide, which is called iodine in your body. So iodine is a vital mineral required by your thyroid for really optimal function, as well as many other organs. And I say that it's vital because the thyroid hormones themselves are simply iodine and proteins bound together. So your bromides, fluorides and chlorine, they are prolific in our environment and they compete with your iodine. So they're in our drinking water and food, in the furniture, carpeting and clothing, and even some of them are in our medications. So some patients who think that they are experiencing cardiac distress, menopausal symptoms, hyper and hypothyroid states, so people who are over or underactive, and even patients with nervous system symptoms may just in fact be suffering needlessly due to the amount of these halides in their tissues. So the halide related symptoms can include drowsiness or hot flushes or palpitations, fatigue and nausea, acne or skin rashes, blurred vision, dizziness, hallucinations, increased thirst, hunger and urination, pancreatitis, muscle weakness, hypothyroidism, poor memory, and there's also an increased risk of your ADD, ADHD in children. So they're in our drinking water, in food, they're in the furniture, carpeting and clothing. Like iodine, fluoride, chloride and bromide, they're all very highly antimicrobial, so hence their use as fumigants in farming industries and as cleaning agents in the dairy industry. So if you still think you're getting lots of iodine from your dairy foods, think again. Bromide has long replaced betadine and iodine in the actual milk farming industries. And even in our medication, some halides such as fluoride are used as a binding agent. So there's newer medications and generics and different tablets used all the time. So the list of which medications absolutely do and do not contain these toxins, it may fluctuate a bit. But nevertheless, as an informed patient, you do have the right to know what it is that you're taking. So some common examples that you may know about are cholesterol-lowering medications, atorvastatin, which is also known as Lipitor, antifungal medications such as diflucan, a range of antibiotic and anti-malarial medications, arthritis medications such as Celebrex, and many other anti-inflammatories. Many antacid medications also contain fluoride. There are many more that I have actually mentioned today. There's a fantastic pharmacist, Susie Cohen. She wrote a whole book called Drug Muggers and about the effects of medications and all the nasties that are in there. I'm only listing a very few here for you, which are fluoride related. So, unfortunately, despite many patients' concerns, I must advise never to stop taking your medications without consulting your doctor, just because suddenly discontinuing some medications can cause not very nice side effects. So please do take that into consideration. And if you are on any medications I've mentioned, please do discuss with your doctor if there's an alternate option or medication. And in the meantime, additional natural therapies, treatment and support is most likely required in order to achieve really optimal health. I'd like to get you to think of avoiding medications a little bit differently. Picture getting rid of the problem so the doctor says you no longer need that medication. So a different perspective really can make the world of difference to your health. So many naturopaths and multiple patients are going on diet and lifestyle changes with Himalayan salt and tend to rave about the results. And I wonder how many people and patients, how many of them realize that these important electrolytes, they don't just keep you hydrated, but they are in fact essential to thyroid function and also for eliminating some of these halides from your body, which is fantastic. Thyroid specialist Dr. Brownstein has many publications on iodine and thyroid health, and he's even dedicated whole books to topics such as the importance of salt and the dangers of the cholesterol medications. So the thyroid, breast and ovarian cell wall, so the wall of the cells, they require sodium to allow nutritional iodine inside of the cells. And Himalayan salt does contain many trace minerals, but I have to mention that you should absolutely be avoiding any packaged or processed foods which contain high levels of the refined sodium and potassium, amongst the other nasties in packet food. in order to be able to sprinkle the Himalayan salt into your food and into the water throughout the day. So removing the potential sources of halides is still an important step, even if you are starting to get the Himalayan salt in the diet. So wash all your new clothing in natural deterrents before you wear them, natural detergents, sorry. Investigate any medications and food sources, reduce the intake of packaged foods, and eat organic, unprocessed wherever possible. So myself and other naturopaths at the Lucy Rose Clinic, we do recommend specific thyroid screening, pathology testing, and diet and lifestyle advice. We're all individuals, so further testing and investigation is often very important to a patient's understanding of their health. How can you be expected to make a good decision about your body and what's best for you without informed choices? So how can you be confident if anyone's advice is right for you as an individual without that? And that's part of the reason that we are an integrated clinic. So we incorporate hormone testing and assessment, including blood testing, thyroflex, temperature, and urinalysis, along with nutritional, herbal, and dietary medicines. Speaking of diet, I hope today's information has given you a little bit of food for thought. We have lots of blogs, articles, and we also have a free ebook available from our website. And for more information, you can also follow us on Facebook or Twitter. Thanks, guys.